Okay.
And now it's going.
Great. So, I have this little like welcome thing, but I've already recorded it in the past, so I could use that.
Mm-hmm.
But maybe I'll do it one more time here too, just to give us like an intro.
Yeah.
Okay. Welcome to Solutions from the Multiverse. SFM is an independent podcast that brings you new, unheard of solutions to the most pressing issues facing the United States and the world. Stay tuned through your favorite podcast provider. Today's a bit of a special day. I'm Adam Browse, and I'm here with Scott Maupin.
Hello.
As co-host of Solutions today.
Yeah.
And how's it going, Scott? Do you want to tell us a little bit?
It's going great. It's beautiful outside. So
it's really beautiful. Here we are inside recording our voices into a can.
But it's great to be here. Thanks for having me.
Yeah, you're welcome. I really like your podcast. Do you want to plug it for the people before we get started?
I make a podcast on my own called The Perfect Show, where I just kind of put out an episode every month or 3 weeks or so about a special little like perfect thing that I'm trying to examine. But yeah, that's my little darling.
It's awesome. I totally love it. And I listen to every episode with joy.
Oh, thank you.
Yeah, I dive into those little perfect moments that you bring to people. So definitely check out The Perfect Show wherever you're listening to podcasts. Well, today I thought we'd talk about healthcare.
Nice.
It's screwed up in America, especially. Okay, so we're going to start with the solution from the multiverse. So the portal opens into the multiverse. We go to the universe in which this problem is not a problem anymore, or at least it's a better than it is here. And we look around and we say, what's going on here? Okay, here's the idea. Everyone wants free healthcare, right? A free nurse hotline. So everybody calls, and we got 911 gets you the police. They're rolling out now perhaps a 988 universal mental health care line.
I've not heard of that.
Yeah,
That's
just
good.
coming out. Yeah, it's coming out. Okay, so now what if we add 922, 944 or something, and you call that and a nurse picks up and they say, what's going on? And you say, I've had a bad headache for 3 days. Do I have a brain tumor? And they say, it's not a tumor.
So I know who this specific nurse is now.
Yeah, it's Arnold. It's Arnold.
This seems very scalable.
Yeah, it is.
Arnold, we're going to need you prolific on the phone. What do you need me to do? Well, just your line. There's one time.
Just one thing.
Just every time.
Just tell everyone. Yeah. So that's the idea. And it's like, well, that sounds like interesting. I think it has some strengths, though.
Yeah.
It's got some strengths. It's maybe got some weaknesses. I don't see those because I'm just blindly optimistic, But I think it's got some really strong strengths.
So you set up a framework where there's always like a network of nurses ready to answer like this level of healthcare question for people.
Right.
What do you see as the benefit for this? How does this help? In what ways?
Yeah. So the cool thing, you say set up a network, right? Okay. So this is the cool thing. Turns out this network is already there.
Ooh.
If you take your insurance card and you flip it over on the back, depending on which side you think is the front and the back of your card, it'll say nurse hotline number. Every insurance company does this. They keep an insurance, a free nurse hotline line open already. And if you call it, you get a nurse immediately, a registered, like real RN, like a real solid medical professional. I've used it multiple times. It's really impressive. One time I was walking around in the sun all day, and I was like, and I started to feel really bad and woozy, and I was like, I'm having a stroke. I was, I think, 29 at the time. Turns out 29-year-olds.
Not a common stroke age.
No.
Okay.
But I was an idiot. Continue to be an idiot in some ways. But so I called this nurse hotline, and they were like, she was like really nice, really friendly, really professional. Like it was as if literally I was sitting in the office with a nurse, like in a hospital, like in a healthcare environment. Really, really professional. And she was like, so tell me about your day, and I was like, well, I was walking around this parade in the Mission, and then I was doing this and that. And she said, had you had any water today? you know? And I was like, oh shit. Insane.
Have you tried unplugging it and plugging it back in?
Exactly. The medical version of the IT crowd, right? Yeah. So that was a cool experience. And I thought, you know, a lot of times people are having, I mean, I'm not trying to trivialize people's medical, you know, demands, but there's a lot of really serious medical things happening. And obviously you couldn't call this and say, oh, well, let me tell you my 5-year battle with, you know, diabetes. And now I'm having this critical event. It's like, okay, in that case, you should know, you should already be like at your provider at the emergency room or something.
Yeah.
But there's so much healthcare out there that is just reassurance. Or triage, saying, hey, you know, you really got to get your ass to the hospital. Like, you actually have a problem. How many, you know, middle-aged men are walking around saying, I'll get to it. I'll get to it later. I'll get to it.
This hard lump on the side of my whatever is totally normal. I'm sure. I'll a few more months, maybe.
Yeah. I'm short of breath and sweating all the time, but I'm sure everything's fine.
I've grown a third ear, but I can hear things better. I'm sure it's great.
I think you're a superhero.
Yeah.
That's nothing. That's not a medical event.
Yeah,
you need to call Xavier. You need to call the X-Men.
I see this helping on both ends of the spectrum, both the people who would not get medical advice otherwise without like this easy on-ramp to like some qualified, reliable stuff. But also on the other side, the people who are going to be wanting to get too much medical advice, because without this anyway, I am anyway showing up on WebMD at 3 a.m. and going, okay, well, it must be this. And now I'm going to spiral it into this. And by dawn, I'm sure that I have the plague 10 times over, you know, like, and it would be nice to have a helpful, reassuring voice at that time to be like, all right, don't go crazy here. It's probably this, that, or the other, and nothing past that, you know?
Right. So it helps at both ends.
Yeah.
And just, I think about just the worried mother or father who's taking care of their sick kid. And, you know, the fever is pretty bad. And like, it's been going on for 2 days. Like, you know, and it's really hard to get hold of your actual family practitioner.
Yeah.
Whereas if you had this, you get a nurse literally at the snap of your fingers, and they say they have a clear list because they're triage. They're what are called triage nurses. That's what they are. Triage nurses. They're triaging medical events. So they have a clear list for every kind of thing. They have a clear list of questions to assess the severity and tell you, oh yeah, shit, this kid's got to get into the hospital, or, you know, it's fine. Just put a cold compress on his head, or, you know, wait a day and call back, or, you know, when are you going to see your primary care physician? You know?
Yeah.
So they have a list of questions that are going to put people in a better track. So here's the other advantage here. So I said the nurses are already there. Okay. These nurses do not even need to be the employees of the government. All you do is you add a single code to Medicare called Nurse Hotline Contact Call. And you say, will and reimburse, I don't know, whatever it is, $30 or something, you know, because these calls are, you know, 15 minutes long or whatever. And, or maybe it's $50. Who knows? I don't know. Some economist would have to figure out what the exact pricing would be.
Right.
And all you do is add that. And then those nurses, they're on electronic medical records. They'll just say new contact. They'll type up a note and they'll be done and they'll keep going. And that will automatically flow into the billing system, which will automatically bill out to Medicare and paid for.
So like how it is now with individual insurance companies, but with the, you know, like the Medicare as the anchor to make it work nationally.
It's the payer. It would become the payer. So the nurses could all be hired by every health system in the country. It doesn't matter. Or you could set up, you know, call center. I mean, you could set up, and it wouldn't even have to be call centers. These nurses could work from home and sign on and be working in shifts, and then the calls would route, you know, directly to whoever was free at that moment. And yeah, it could be it's actually a great job. You could sit there and say, yeah, I work from home and I'm raising my kids, or I'm doing this or that. And I work, you know, 20, 40 hours a week as a triage nurse. And I just pick up the phone. You know, I put my headset on and I'm at my computer and I talk to people and I reassure them and help them with their health. I'm the front line of our healthcare system.
Yeah. And cost wise, I mean, I'm one of those wacky people who thinks that there's a good value in having a less sick population. And so
You're crazy.
That
You're
having
crazy.
people not be sick all the time pays for itself in its
absolutely.
own sort of way.
Oh my God. I mean, if you really, yeah.
But also the value that you're providing is, I think that's insanely is a bad word, but I think that's incredibly wise to implement. That would be a great thing to go nationwide.
Yeah, I think people would say, I mean, I think there's so much political fight over, Medicare for all and like, how do we, and this is an idea that I've never heard anyone say. No one's ever said like, hey, yeah, Medicare for all is great. Bernie Sanders, say what you will, obviously providing some leadership in the country. But seemed pretty difficult to get his agendas across the finish line.
Right.
But this sounds like something where it's cheap. It's easy in terms of implementation. You're literally just adding one code to the Medicare procedural, guidelines, and then you're just promoting it. I mean, you'd have to do some advertising to tell people you call this one number anywhere in the country. I don't know. Would there be a political fight over this? Or would it be seen as a kind of compromise between maybe more corporate neoliberal Democrats with the more kind of progressive sort of social Democrats? And would the Republicans fight it? I don't know. Obamacare is Romney care, right? Like the Obamacare just lifted Romney care from Massachusetts and made it nationwide. I don't know. I wonder if it wouldn't go over just fine.
I mean, it feels like it's all about how you sell it. So that gets left up to the marketing people who spend all their day figuring out what exact wording of what does the best. But you would hope that it wouldn't be a big fight, right? You would hope that someone would go, oh, I don't want to fight against this just because the person I don't like is for it, but I can look at it and go, oh, this is good for everybody and easy and cheap. Right. This is a no-brainer. Right. Let's put it in.
And just the lightness of it. Like, I don't even know what the cost would be. Obviously, I invite someone who really wants to crunch the numbers to kind of think about it. But I mean, I don't know. There might be, maybe there's 350 million people. Maybe a third of people would use it every year. So it's like 100 million calls. It's like 100 million calls, $30 a call. It's like $3 billion or something. But in terms of healthcare reduction of costs, it's going to be insane how much you save. Just for example, one of the parts of this that we haven't touched on is going from the actual triage action of the nurses. So if somebody says, hey, I'm like really injured, they're like, go to the emergency room. Okay, but then that now becomes a worthwhile use of emergency room expenses, which are very high. But most people, the vast majority of people, like whoever, like anyone, the most common thing people should actually do is go to the urgent care. Urgent cares are open all over cities, every city in the country. And you should just take an Uber to the urgent care if you're really having most things, unless you're really in dire straits.
Right.
But that distinction between emergency room and urgent care is a $1,400 difference, right? And then the same urgent care versus wait a week or 2 or 3 weeks to get into your primary care physician is another difference in a few $100. So just having this to get the nurses to say, you're fine, reassurance, don't do anything, or put a cold compress on your head and take an Advil, or go to your primary care, or go to your urgency care, or go to emergency care, you're going to save, oh my God. I mean, I don't know the numbers off the top of my head, but it's tens of billions of dollars are just wasted on people going to the emergency room when they don't need to.
Well, you have a system now that's funneling everybody in a large percentage. It's funneling people to the wrong places over and over again, and putting in a system that funnels people to the right place the first time is, that's a huge,
be huge.
That's a huge
I even
benefit.
think like somebody, like a kid, I don't know about you, but when I was a kid, we would just tear around, and we always got hurt and bumped and bruised, and
sure,
I broke my foot, broke my hand, broke my bones, broke my head, right? And my parents were doctors. I have doctor parents. This is part of the reason I know all about healthcare. Is parents are doctors, so they were like, "Well, this is just you're fine. They were often like, you're fine. But if you don't have parents who are doctors and a kid comes in and they're limping and they say, I bumped my head, they're crying, and you think, oh shit, I need to go get some care for this kid. But if you could just call this number and be like, yeah, he was playing around, he bumped his head. And then they say, well, do a brief concussion check. And you don't know the concussion checklist,
right?
But they do. And they can walk you through it. You do it. And then they're like, oh, he's fine. He's just crying because he bumped his head. Or, shit, he really had a pretty serious concussion. Like, he should be seen immediately. He should have a CAT scan. Like, there's a huge range in there.
Sure. And when you're a parent, you're just like, well, now I'm in charge of someone else's. Like, it was all fun and games when it was just me and my body, but now I'm in charge of someone else's. So if they cough or sneeze or something and I go, man, it's probably nothing, and it's not nothing, well, then I'm the worst person ever. So of course I'm going to look at everything and turn every dial up to 11 if I can as that person,
you know? Yeah, in a way, this would really be supportive for families and parents, probably more than almost anything. It seems like, and the elderly. I mean, obviously, pretty much any vulnerable population, this would be a
everybody.
Huge boon.
It's good for everybody.
Yeah. I love though that it's just. I mean, I'm in favor of Medicare for all because I've lived in other countries where they have that, and I ran a hospital billing system across multiple hospitals. I've run those systems, so I know that it would be better to have Medicare for all. But not everyone knows that. Not everyone believes that. This would be a way for people to see how awesome and efficient a system that just helps everyone is. So it's kind of an interesting topic.
I mean, I am also, I'll say, clearly biased. I've lived in a place where I had nationalized healthcare and enjoyed it quite a bit.
Yeah.
And so it does seem crazy coming back after doing that to a place where it's all a for-profit, sort of like everybody is on their own situation. You're like, wow, it definitely doesn't have to be like that. I've been to another place where
we can have nice things, right? It's like we can have nice things. I mean, yeah, it's just politics, I think, that really prevents us from having just a fully, a really large risk pool, basically 100%. Everyone's in the risk pool together. But this could be a way to have people solve the worst problems, help people out, and have people feel a material difference in their lives.
Yeah, because I think with the healthcare, what we're running into is systems, once they're set up, are set up to run and continue running and not be easy to dismantle and topple over. And so you're looking at that and going, okay, well then let's set up a system that can run and be useful and then be difficult to dismantle and helps people, like with a like a nationwide nurse hotline system that would use that sort of thing that works against us in our healthcare, but use it for us for once.
Right. And all the arguments against a more robust risk pool, like a Medicare for all or some kind of universal risk pool is always, well, they want to illegalize insurance companies. Well, this definitely doesn't do that. No. Like, everyone still has private insurance, still pays, but all the worst psychic pain and all the uncertainty and all the just inefficiency of going to the wrong person at the wrong time and having the wrong level of care given to you would be greatly eliminated. So in a way, it's so, I mean, I consider myself somewhat revolutionary, but this is actually a very, very reasonable kind of moderate thing to add, but it could be quite transformative actually.
Yeah.
In terms of shaving off a huge amount of the cost and,
bloat. I mean, just extra. Imagine if all the healthcare professionals don't have to deal with as many, I stubbed my toes or whatever.
Right. They hate that. Doctors hate that. They don't hate their patients. They love their patients. They want their patients to be healthy. But, when they think about their day, the most satisfying moments of their day is when someone who was sufficiently sick came in that they could actually help with the titanic and amazing tools of modern medicine that they have at their disposal, right? Yeah.
They also want the right person to be funneled into the right place.
Right, exactly.
for their benefit.
Yeah, otherwise it's just like grist in the mill. It's just like this sort of, bumps and bruises. They want someone who really can match their, expertise and their ability. So yeah, the other thing is there's a political aspect to this that's, I think maybe it's partisan, maybe it's not. So much that's wrong with America right now is a distrust of institutions. And the reason why there's distrust in institutions is because a lot of our institutions don't just, they do things every day, all day long, they do things, but we don't feel what they're doing, except for when we get a speeding ticket, we're like, well, I guess that's working, but we don't feel good about that, And everything else that does affect us seems like we're on our own about it. But if you could show, hey, you call this number, you talk to a really nice, friendly, professional nurse, and who's not an employee of the government. They're an employee of Kaiser Permanente or United Health or some health system.
Right.
So they're like great. They're a high quality healthcare worker. And you talk to them and then you hang up. And in the back of your mind, you're like, dang, like the government can like actually do things for us. Like that really worked. You know, that was great. That's federal. That's a federal program. Like it would give people this experience, and you could have it all languages, right? You could say dial 42 and you get Hindi, and there's a Hindi nurse on the other side. Like you could have it totally work for everybody in America. And it would just, I don't know, it would just create this experience of like trust and happiness and more trust in our institutions. Think about with COVID, people could have said, oh, do I have COVID? All those questions could have gone to this, and it could have just taken the burden completely off of all these. I mean, not the burden of actually caring for people who are really suffering with COVID. That would obviously be at the ICUs, but it would take all this little nitpicky, well, I have a sniffles. Do I have COVID? Oh, it's COVID stuff.
That whole, those months of, I have a certain amount of, I'm feeling something, but if I go into a healthcare place with a bunch of other people, am I actually risking more than I'm benefiting? You know, is this
good point? Move? Good point. Right. Should I go even into the hospital?
We definitely dealt with that. Yeah. We were like, if we get sick, do we go into what do we do?
Right. And if you called that nurse hotline, they'd say, you know, there is a risk. So actually just take it home. Or they'd say, no, you're ill. Like you need to risk getting an upper respiratory virus.
What stage are you at? And we'll give you the right advice.
Right. Yeah. Oh God. I just love it. And but believing in our institutions and making people understand that like the federal government does something for them. I think any politician, it was probably be the Democrats who would support this, but it's something that I think left-wing and right-wing Democrats could come together on. Conservative, corporate Democrats and progressive Democrats could come together, and the progressive Democrats would be like, this is great. This is essentially Medicare for all, but just in this really narrow delivery mechanism. And then the corporate Democrats would be like, this is awesome. We get to keep getting donations from our corporate, private insurance companies and drug companies, but we get to reduce the cost of healthcare. I don't know. I'm just throwing ballpark, but at least 10%. I think this would reduce in general, at least the waste. It would reduce a lot.
That's huge. I mean, those numbers are massive.
I know. Anything you can do is like tremendous, right? Yeah. And it's all set up already. The whole thing's set up. It would take very little coordination. I've run hospital billing systems. Like I'm not just some guy, this is like, this would be something that you could just turn on. I mean, you'd have to do some work. You'd have to talk to the right people and get it.
I am just some guy. I have not run hospital billing systems, but it also sounds like a good idea to me.
Yeah. So I think the only problem would be the politics of it might be a little hairy, but I don't know. I think you could get the Democrats to unite around it. I mean, this is something that like Manchin and Sinema would probably go for, because it leaves everything in place. It leaves all the for-profit stuff in place. It would just maybe take down some of their billing hours, but it also would improve their efficiency. So they like that too.
Right. I was going to ask, do you pitch the politicians first, or do you pitch the insurance companies first and be like, where do you position your messaging if you were going to try to actually make this happen?
I don't know. I don't know enough about politics. I think we'll just make a podcast about it.
That seems to work. I think that works.
That's the future. Well, Scott, this has been a fantastic conversation. I feel like we've dived deep into this solution.
We solved it, right?
Well, we didn't really criticize it very much, but maybe, I don't know. I can't find, I'm very critical, devil's advocate. But this one, I can't really find anything really wrong with it. It's like, it just seems so.
That's the beauty of publishing stuff on the internet. Other people can find stuff wrong for you.
That's right.
And they're more than happy to let you know what you messed up.
Well, we should, anyone, if you got to, and if you have if you have a solution for the multiverse, like a solution that you've never heard anybody say and you've been thinking about it, send it in.
Absolutely.
And we'll look at it and maybe put it up there. So, solutions from the multiverse. Tune in next time for the next solution.
Very nice.
Thanks so much for being with us, Scott.
Yeah, thanks for having me.
And make sure everyone to go check out The Perfect Show.
Yes.
Yeah. Shameless plug.
All right. Bye-bye.
Take care.